So, first, we want the inferior tib fib to be the most stable, right? That's the most important thing in that terms of that joint, that it has to have stability. And we looked at stability tests in the peripheral manip by doing our ligament stress test, anterior drawer, posterior drawer. Yep. Okay. So now I also want to look at the lateral. Lay on your back. Eric didn't do it because he said there was no validity, I think, in terms of the... Yeah, you did. Actually, I remember it because I was surprised. But that's okay.
And I apologize to everybody I did the skills test on. I said, now what about the lateral stability?
Yeah, we didn't do it. And, well, you just said you had read a research and it clustered up that the anterior posterior were the best of the test. And so I just thought we weren't doing the lateral.
Yeah.
Doesn't matter. Doesn't matter.
The reason that I don't like lateral stability is because you lay them on their side and you try and push into the table. So the table is blocking the fibula from separating anyway. So I don't think that the construct validity of it is very good.
And I think in terms of looking at it like that, I actually like that. Now, in terms of looking at the fibular dysfunction, I think now we have to come back to it. Because now we're actually talking a little bit more about it. And I have seen enough positives that we'll just discuss it again as you all keep practicing and decide. So there's two ways to do it. Jim does it this way, where he comes up on the superior portion of the fibula, gets on the talus, and you're just driving the talus straight laterally. So you're trying to create a bending moment. And the other one is the one that Eric was talking about, is laying on your side, foot off the end of the bed. Is that okay, Jen?
Mm-hmm.
Okay. And I'm going to be on the talus, and I'm going to now push through the talus to try to bend that fibula. Let me see the other side. Other side, sorry. You just proved my point. Oh, this is the leg I need to test, right? This is the leg.
did that one.
Okay.
Yeah.
Okay. Look at this. Boom. Tight. Yeah, can you see it? Go on your other side. Is that pressure okay on this one?
Yeah, it's fine.
Okay. But, Eric, come here, buddy. I just want to save my back a little. Will you go through anterior posterior and the ligament stress test real fast if we're writing?
Okay.
You don't have to say anything. Just do them. I just want to know if she's stable.
Anterior posterior drawer.
So we have, if we're going to manipulate this joint, we have to know about stability.
Yeah, she's okay.
Everything's tight. Okay, so what did I see in the lateral stability? Now when we look, I'm sorry we don't have bone, so I said there's just a little corner that the inferior, that's a little tiny triangular facet of this joint. And when you get this problem, if it's persistent, I have seen where we've lost the anterior glide of the fibula. Lay on your belly now. Okay, so that glides. Nothing. Fred, you wanna verify?
Yeah, and what I was gonna say is I had that kid who fractured the dome of the talus and just had that persistent, I couldn't keep it where it needed to be, and this is where I thought, yeah, it's
Okay.
stuck posteriorly, yeah.
So I think it's always stuck posteriorly, and we only need to go anterior. And I think it's just because of the curvature of the fibula on the tibia. Okay, because it's male, isn't it?
Yes, it's opposite than the
Yeah.
other, top and
Yeah,
bottom, it's
so
like
it's
this.
male.
Yeah.
And so it's got a curvature, and so the only thing it can do on that little triangular facet when it gets into trouble is go backwards. And that's because the force is coming up on that superior tib fib. Okay, so this is the only time I do it, and I do not do a straight arm technique. I do just scoot down just a little bit. And would you raise my table up for me, please? So, we said we had a superior inferior problem, so that's why we're getting that lateral give, because everything's not quite set well. That's good, sorry, I wasn't paying attention. So what I'm going to do is I'm going to stabilize the talus, I'm going to stabilize the medial malleolus, and with my thumb I'm going to get on the posterior aspect of the fibula, and there it goes. Okay, lay on your side, your right side. Yep. Good. So let me see, lay on your belly. Yep. There's our Clyde. That will help that pivot. So she's so stiff and tight up here, and it's been so prolonged that she actually just got off the groove, if you will, at the inferior joint. So it's going to mess with her ankle a little bit. But that's the only time I do it, and I do just like we do the carpals, because we're not wanting to mess with the mortise. And that's why I hate the straight arm technique. Oh no, do you guys like the straight arm technique? Yeah.
I don't know that I'm necessarily that,
I'm not
I don't think I need that
It's-
much force.
Good, so you don't need, I'm telling you, this is a little tiny joint, it needs just a little bit of flick, and then it sets, and if she stands up, she'll feel better weight bearing. It just changes your weight bearing again. Pop up and see if it feels different. Yeah, so it's not that the fibula changed, it's now she can load in her talar crural and her subtalar joint, so that's what she's feeling.
Snap it back into its
Yep.
proper groove
Yes.
so it becomes stable again.
Is it crunching?
Will this affect your Portland's test? Maybe a little bit.
Some of that's windy, but it's very better. It's like,
Okay, so let's just assess the inferior tib fib joint.
That's how.
Jen got a groove back.